If bowel cancer is caught at its earliest stage, more than 9 in 10 people, 90% are still alive in 5 years' time. And if that very same cancer is caught at its latest stage, that number drops to around 1 in 10, 10%. And that huge gap isn't about the cancer itself being any different. It is about how long it was left before anybody looked at it. Bowel cancer does usually warn you. It's just that the warnings are easy to put down to something you ate or to stress or just getting older. So today, I'm going to go through 6 warning signs of bowel cancer in order, starting with the easiest to ignore and then finishing with the most serious of all, which does need an ambulance, and I'll save that one until the end. And with each one of them, I'm going to tell you what to do about it. Whether that's a routine GP appointment or, a same-day appointment at the surgery or indeed a trip to the A&E. If you're new to this channel, then thank you for watching this video. My name is Dr. Alex. I'm here to help you live longer, and in this particular video, catching things that otherwise would be caught fairly late unless you knew about the things to look out for. And if you want a bit more information on similar things that I talk about in this channel, then I have started a daily newsletter where I'm going to send you an email every single morning. Whether that's a tip or a research study, a personal experience, or anything that I think you will find useful, basically an extension of this YouTube channel, just go to dralexnewsletter.com to pop your email in, and I will send you that first email tomorrow morning. So the first site to talk about is bloating. And it's on this list because it is so ordinary that it gets ignored for months at a time. Now, bloating that isn't anything to worry about tends to follow what you've eaten. So it's worse after a big meal or fizzy drinks, or particularly bad after something like lentils or a bean salad. Trying to be healthy, so you cook with more veg and legumes, that sort of thing. But it typically settles overnight, so you wake up flat and comfortable again like you were the day before. The sort of bloating that is worth getting looked at is new. It is there most days rather than just now and again. It's lasted 3 or more weeks, and it usually comes on with cramping pain as well, and it doesn't settle overnight. Now, to understand why this happens, it is easier to imagine your bowel as a big host pipe. If something growing or something starts growing on the inside wall of that pipe, the space inside the lumen, what we call it, gets narrower. So gas and poo or stool have to squeeze past it, and then everything backs up behind it a bit. The wall then stretches, and stretching is exactly what the nerves in your bowel pick up and report back to your brain as pain and cramping. So what should you actually do about this? Well, this one for most people, if it's been going on for a few weeks and you otherwise feel well with no other symptoms, this is a routine appointment with your family doctor. And it's also worth asking about a fit test while you're there. They may just do this anyway. And this is just a small kit that they usually send you, but you take it home with you and you put a tiny sample of poo in a tube, and then you post it back either to the surgery or to a particular lab, and they look for traces of blood that are far too small to see with your eye, microscopic blood. Now, the next one to talk about is being tired and out of breath, because sometimes the first sign of a bowel cancer has nothing to do with the toilet or your stool at all. Some people notice this because they are suddenly out of breath halfway up the stairs that they've climbed fine, for years without ever thinking about it. What's happening in this particular case is that a growing tumor builds its own blood supply pretty quickly in a hurry. So those vessels are very fragile, and they tend to leak small amounts of blood into the bowel more or less constantly. And you know how I mentioned the fit test before? This blood is far too little to change the color of anything that you see. So you're not seeing bright red poo or dark black poo, but day after day for months, it slowly drains the iron out of you. Now, your body needs iron to make hemoglobin, which is what carries oxygen around in your blood. So, as iron runs down, every litre of blood carries less oxygen than it used to. Your heart then tries to make up for that by beating a bit harder and a bit faster. And what you feel is tiredness that sleep simply doesn't fix. And breathlessness on the stairs and on a very gradual hill, and then people telling you that you look a bit pale. This is a bit like a very, very slow puncture in your car tire where nothing dramatic happens for weeks and you only notice it when the car stops handling properly, or it just feels a bit odd when you're turning a corner. Now, the thing that sometimes gets missed here is that in a man of any age or in a woman who has been through the menopause, there is no everyday reason to be low in iron. So it always needs explaining, and the bowel is the first place that we look. What tends to happen is people instead buy some iron tablets over the counter from the supermarket. They feel a bit better and they never ask where the iron was going. The The whole point is that if somebody's bleeding, or even if you're before the menopause and things have changed, then this one has to be a routine appointment with your doctor. If you're feeling a bit breathless and a bit more tired than usual, then you've got to book an appointment with your doctor, and they will examine you. They will take a thorough history, and they will do some blood tests, specifically a full blood count, and also a ferritin level as well. The third sign is a change in your bowel habit. And by that I mean one that sticks around and persists. Persistent changes. This is what's important here. And the thing is, there is no such thing as a normal bowel habit. There is only what is normal for you. So what matters is when yours changes and stays changed for 3 weeks or more. 3 weeks is roughly the point where we stop putting it down to a stomach bug or something that didn't agree with you, and we start looking for a proper reason. Now, a change might mean going more often than you used to, or your poo that has got a bit looser and it's stayed looser as well, or new constipation that isn't shifting, or that feeling of having been to the toilet and then still not feeling properly empty. And the pattern here varies for a reason. On the left side of the barrel, close to the exit, the stool is already pretty solid. So anything narrowing the tube there causes obvious trouble getting it past, which is where constipation and then thin ribbons, like really thin, streaky stools come from. Higher up on the right side, then everything there is usually still liquid because that is earlier on in the colon. So it slips past easily, and that is why cancers there often cause no change at all and turn up as the tiredness and the low iron instead. So if you've had a persistent change in your bowel habits, you've got to book an appointment with your doctor. Just get it checked out. Even if it's been just 3 weeks, it is better being safe than sorry. Number 4 on the list is losing weight without trying to unintentional weight loss. This is what we call it. And while that might sound like a good thing for some people, this is one of the things that we worry about most as doctors. The rough guide is 5% of your body weight over 6 months unintentionally. So if you weigh, say, around 80 kilos, that is 4 kilos falling off you with zero change to what you're eating and no extra exercise or an extra, notch on the buckle on your belt. And there's a couple of reasons for this. So a cancer is tissue that is dividing constantly, is rapidly growing. So it burns through a lot of fuel. It also releases inflammatory chemicals called cytokines, which travel around your body and reduces your appetite and tells your muscle to be broken down and used as fuel. So, and a lot of people, yes, they are eating less, I guess, but they're burning more as well. And what you lose isn't only fat. A lot of it is muscle, which is why people feel weak and say their clothes have started hanging off them. The belt that you wear every day is pretty useful here, a bit more useful than the scale. So pay attention if you've gone in a notch, you've reduced a notch on your belt, or, anything else that you've noticed without meaning to. And if somebody in your family tells you that you look like you've lost weight, and it came as a shock to you because, nobody else has ever said anything like this before, then take that seriously. And this sign moves the urgency up a bit. What I want you to be doing, if you've noticed significant weight loss that you hadn't planned or you've not got a reason for, then you want to be seeing your GP within days rather than sometime next month. And just say those words when you ring up that you've lost weight without trying, because that changes which pathway you get put on, and you should hopefully see a doctor rather than anybody else. And there is an urgent route where you should be seen within a week or 2. Number 5 is bleeding, which is the sign that people expect with this sort of topic. When we're talking about bowel cancer, it's also the one that gets brushed off most often, in my experience, usually by assuming it is piles or hemorrhoids. So what might you see? Well, bright red blood on the paper or in the water often does come from piles or a small tear, what we call a fissure, but not always. This is the important thing. Darker blood, so darker red blood mixed in with the poo itself, is more concerning because it's come from further up and it's travelled down with the stool, so it's had time to be mixed in with it. And a stool that looks black or sticky or tarry means bleeding from higher up, and that is never normal. That is digested blood. Now, piles or hemorrhoids are very common, and that is part of the problem here, because having piles doesn't mean there isn't something else going on as well, and plenty of people have both. So piles is a perfectly reasonable explanation, but only once a doctor has actually examined you And if you're in the right age group, you've done a fit test as well. And if you can see blood with your own eyes, a normal fit result on its own isn't enough to close that case. So basically, you've got to be examined and have some other tests as well. Now, blood that you've noticed once or twice where it's not persistent, this is a GP appointment within the week, preferably same day, rather than waiting to see. But if the bleeding is heavy, if you are passing clots, if you're feeling dizzy when you stand, or you've gone cold or clammy, or your heart is racing, clearly what I'm describing here is bleeding from your back passage. That is incredibly serious. You have to go to A&E right now, or just call 999. This is too serious to be waiting for anybody to take you. Just dial 999 or 911 for the ambulance. And then finally, the most serious sign out of all of these, the one that I said would save until the end, is a blocked bowel. And this is the one that brings people into my department on a trolley incredibly unwell. There are 4 things that go together here. Severe cramping pain that comes in huge waves, a tummy that is swollen or distended, and, when you tap on it, it sounds a bit like a drum, vomiting that just won't stop. And then also complete constipation, so not passing any poo or also not passing any wind as well. And that last point is really important. The wind part especially, because stool that is already past the blockage can still come out and make you think everything is fine. But if you're not passing wind, it shows that there was a complete blockage somewhere. What's going on here in this scenario is the tube has gone from narrowed to completely blocked or twisted perhaps, but the bowel above carries on working. So food and fluid and swallowed air pile up behind it, and the wall of your bowel stretches further and further. Once it's that tight, it squashes the very small blood vessels running through the wall. So that tissue starts to die and then can burst open, spilling the bowel contents into the abdomen. And that causes, a huge infection called peritonitis. And people become unwell very quickly. They can go into septic shock very quickly. So this one, obviously, without question, is an ambulance scenario. And more broadly than that, a very painful tummy or feeling really unwell in yourself, whatever the cause is, that is reason enough to call 999, whatever the cause turns out to be. 2 last things that we got to mention here. If you're in the UK and you're between 50 and 74, the NHS posts you a screening kit every 2 years, and the age it starts came down to 50 fairly recently, which is a great thing. They reduced the age. So if one lands on your doorstep, then please do the test and send it back, because it is looking for exactly that invisible bleeding that we talked about earlier, years before you're noticing anything else concerning. And if you've not had this fit test land on your doorstep and you're well within that age range, then please call your GP. Make sure that they've got your correct address. And if you're watching in the US, screening is recommended from 45, usually either a colonoscopy every 10 years or a stool test at home each year. So ask your doctor, which one is suitable for you, depending on, your medical history and your background. But the thing is, screening does not cover you for symptoms. So a normal kit 18 months ago tells you nothing about a change that started last month. And bowel cancer really has been rising in younger people. So being in your 30s or 40s does not rule this out either. If you are in your 30s and you have any symptoms at all, however vague they are, tiredness that you can't explain, feeling a bit breathless, some odd feelings in your bowel, some tummy pains, anything at all, then go and get checked, please. I know people personally that have died from bowel cancer who are pretty young. It's not that uncommon these days, so please don't ignore anything I've mentioned in this video. There is no reason too small to book an appointment with your doctor. I hope all of that was really useful information. Please put any questions you've got in the description below. I'll try my best to reply to as many of them as I can, but I get thousands a day now. And what I'm using these comments for basically is shaping future videos to try and answer those questions in a later video. I hope that makes sense. Anyway, thank you so much for watching. I hope you're all doing well wherever you are in the world.